Right, everyone. Well, I think we can begin here. We have our list there in chat, and we can just go down that list if anyone has any sort of opening comments or anything that they'd like to share. So, Mayor,
Okay.
take it away.
All right. Thank you so much, everyone. And thank you all for being here this morning. We wanted to hold this press conference, obviously, as we get into the holiday season. And we are also seeing some information and some statistics numbers that are actually extremely alarming. We also have some new information starting to come in through our COVID risk meter. So we have a fantastic panel here today. We have Dr. Fry, he is an emergency room physician. We have Dr. Ron Ariel, he is a well-known pediatrician. We have Dr. David White, and he is a wonderful family dentist. And we also have Dr. Jeremy Smith from TMRPA and Councilwoman Naomi Dewar, and they head up our COVID risk meter committee working group. So I'm glad that everyone is here today. Obviously, there are some numbers coming into Washoe County that cause us to have great concern. One of the things that I think is super important right now, we are heading into holiday season. Right now, we've got Halloween, we've got Thanksgiving, and we've got Christmas coming up. And of course, in the holiday season, everyone wants to gather with friends, family, and loved ones. But this year, we really, really need to stress sort of the importance of being vigilant, but also looking at the numbers coming into Washoe County. They are causing for some great concern. So we don't want to alarm anyone, but we really want to educate everyone because we know that we can all do our part. This is a very, very critical time. And matter of fact, I would say everyone knows that I'm a very competitive mayor. So these numbers certainly are bothersome to me and also to many of the panelists that we have here today. The COVID risk meter has been a tremendous tool in the community. It's really been just a labor of love through Dr. Jeremy Smith and Councilwoman Dewar. I'm really grateful for the work that you've put in, but we are seeing some numbers that are quite concerning. So I'm going to hand it over to Councilwoman Dewar to speak briefly, and then over to Dr. Jeremy Smith from TMRPA so that we can get the information, because I believe we are going to be hitting another category, which is very concerning. And matter of fact, Washoe County now is on the radar for some very concerning statistics that we are seeing out of the COVID risk meter. And I want to remind everyone that this meter is specific to Northern Nevada, to Washoe County. And that is the data that we're looking at. And it's really critical right now more than ever. I don't want to be coming back in 2 weeks and finding us in a position where we are in trouble. So that's why we have wanted to message today and educate our community, because now more than ever, we've got to do this together. There are some very simple things, and I know everyone's tired of hearing about it, but it's wear your mask, socially distance, please wash your hands. And right now, I can't stress enough, we need to be listening to our physicians and not our politicians. And that's why I have experts here at the table that have been working with us in this working group for about 7 months now. And I appreciate all your hard work and dedication to our community. All of you have been tremendous. And like I said, I think we brought in some of the best and the brightest in our community. So with that being said, I'm going to hand it over to Councilwoman Dewar, talk a little bit about the working group, and then we're going to head it on over to Dr. Jeremy Smith, that is going to share some numbers that do cause us to have great concern. So with that, Councilwoman Dewar, go right ahead.
Thank you so much, Mayor, and all of the panelists today. I've been working with a small team of scientists, and we have been putting together a tool to make it easier to understand how to modify your own behavior as the COVID risk in our community either increases or decreases. For example, an event you might have gone to with comfort, wearing your mask, social distancing last week, if the meter climbs, you may give that a second thought and maybe decide, I don't think I'm going to attend that meeting or that gathering this week. So there's about 5 or 6 of us. They're all scientists. They include medical doctors. And what we've tried to do is take various parameters that are looked at throughout the country and combine them into a very simple way to give us information and make decisions in our own life. The architect of that meter is Dr. Jeremy Smith, and he's here with me today. He will be on behalf of all of us explaining how the COVID meter works and what it is today and what that means for us in a very simple term. And then we're going to turn it over to our doctors to really expound upon that. And so as part of my Reno City Council job, I'm also chair of the Regional Governing Board for the Truckee Meadows Planning Agency. And Jeremy is the director. He does have a PhD and he has very knowledgeable on analyzing data. So with that, I'll be here for questions, but I'm going to quickly turn it over to Dr. Smith. Please share with us what you've come up with and what it means for us.
Sure. Thank you, Councilwoman Dewar. I'm Jeremy Smith. I'm the director of Truckee Meadows Regional Planning Agency, and I appreciate you having me here today to talk about the COVID risk meter. So I'm going to share my screen and show just 2 slides. Pretty easy here. Let's see if I can pull that off. Okay, are you guys, oh, no, that's not there yet. Are you guys seeing my screen right now? Excellent. Okay, so this is what you would find if you go to the website. It's listed up there, covidriskmeter.org. This is what we've put together. And basically it's a very simple presentation of information on this speedometer-like gauge that to the left we have green, through yellow, orange, red, and all the way to purple if conditions related to COVID become severe. And so what you might also notice is that inside yellow, inside orange, and inside the very high, the red category, there's a couple of tick marks. And so what we're trying to do with that is sort of track which edge we're at in terms of going up or down from one color to another. Each of the colors have an associated set of guidelines that folks can use to empower themselves to change their behavior based on what's going on. So right now we are in the high orange condition. So we're in the second tick mark in the orange section. And what's driving that is some of the data that we use to inform this thing. So we have 5 indicators that we use in the background to make this gauge, to populate this setting. The first is from the Washoe County Health District. We look at all of the risk assessments that they receive in terms of test scheduling. So we have an idea of how many people are going to the health district every day to try to get a test for COVID. We also take the state's measurement of test positivity. So they have a full census of all of the tests that are being administered, and they're taking that information and they're applying it to the positive results and coming up with an accurate test positivity measure. We're also tracking cases. We use the Washoe County COVID dashboard to get those case numbers. And then finally, we have a great relationship with the Nevada Hospital Association, and they've been providing us information about folks that are in the hospital because they have COVID and folks that are in an ICU bed because they have COVID. And then also just information generally about hospital utilization and hospital capacities. And so we put all of that together, and that basically ends up adding together to give us this score. And so on the next graph, what we can see here is the blue line in the center is how we've been performing as a region through those meters. And you can see there's green, yellow, orange, red, and purple in this graph. And I think what you might notice is that we're right up against heading into the red. So we've been in this high orange condition for several days now. And if things continue to go the way they're going, we may get into that red thing and that red condition, and that's going to change the behavioral guidelines that we suggest and make it, that much more severe for what we recommend that folks do, just based on the prevalence of these things. And so what's really driving that, first and foremost, is our cases. So we have seen in the recent few weeks a huge proliferation of COVID cases. We're up to around, I think, 1,800 or so active cases right now. It's the highest we've ever been. So that's driving that number up. But also, test positivity remains high, and we're seeing an increase in medical interventions. So more folks are staying in the hospital because they have COVID or going into an ICU bed. And also, we're getting into the colder season, and so our hospitals are starting to be more utilized. And we're starting to tap into some of that hospital capacity. So those are the factors that are driving us up. And I think hopefully some of the doctors on the call here will talk about, to what degree, how we can mitigate that in our behavior. But I would just say that we're at the edge, and it's up to us to do a good job of keeping our masks on and thinking about what we're doing to keep us hopefully from going into that red condition. So with that, I'm going to stop sharing and turn it back over to you guys. Thank you.
All right, thank you, Dr. Smith. Fantastic. Obviously, that information does cause for great concern. So I want to hand it over to someone who is working on the front lines. That's Dr. Fry. He is in the renowned ER, so he's working with patients every single day and seeing COVID cases come in. And Dr. Fry, I'm going to hand it over to you, but looking at that information does cause for concern. And this is, I would imagine, the time to double down and take this extremely seriously. Dr. Fry. Oh, he's on mute.
Thank you. You think I'd get used to that by now, right?
I know, all of us.
Thank you, Mayor Sheevy and Councilwoman Doer, and what a fantastic job by Jeremy Smith putting this meter together, which we hope will be widely adopted by the community as a tool to utilize on a daily basis to help us understand where we can impact this coming storm. I'd like to start by helping folks appreciate what this uptick potentially into the red really means. First and foremost, I'd like to reassure folks out there that if you become sick, the caregiver community is quite prepared to care for you, and our emergency departments and hospitals are safe places to receive that care. We gear up 100% of the time at work in order to stay well and prepared in order to keep the public safe. Compared to last spring, which is just, it seems like eons in the past, we understand this disease process a great deal more, and the risk factors associated with potential hospitalizations, especially into the ICU and even death. I think we all have to be, community-wide, all have to be stewards of the finite resources we know exist. We have to take extra precautions, as the mayor pointed out, this holiday season to celebrate in the safest way we can. We have a number of events between now and the new year that certainly could turn into what's now known as super spreader events if we're not careful. And this fall and winter aren't going to be easy. I mean, we shouldn't sugarcoat this at all. It's going to be a long fall and winter. And I think that we need to all do our part community-wide to ensure the safety and integrity of both the people and the economy of Washoe County. So, there's a number of recent threats that we're all very familiar with of great magnitude, such as the fires in California, such as the hurricanes in the Gulf. And they're well visualized, right? I'm no weatherman, but they put that up and the visual is very strong and impactful. And therefore, I think people collectively prepare rapidly and efficiently for those types of disasters. But this, unfortunately, is a different and invisible enemy. We have combat fatigue for almost, a year-long war against this invisible enemy. But make no mistake, this is a perfect viral storm heading our way. And as the meter suggests, we're going to uptick into the red most likely. So this thing is gathering strength as we speak. The storm is unfortunately fed by complacency and non-compliance with the governor's plan and decree, and non-compliance with the CDC guidelines, which are really simple and really easy to follow. They're well crafted and they're really to ensure the safety of this community and the nation. Now is the time, I have to reiterate, now is the time to hold the line against this enemy. If we ignore the rapid rise in cases, this will be at the peril of those most vulnerable to this disease. It's such a deceptive disease, COVID-19, and its ability to make you think everything is okay until suddenly it's not. It preys upon complacency. So in conclusion, and really to reach out through the media to those at the highest risk, the elderly, the immunocompromised, those struggling with obesity and diabetes and high blood pressure and lung disease. I really have the strongest recommendations right now and into the holiday season. Don't venture out unless it's entirely necessary. Avoid gatherings and situations that make you uncomfortable, as this is your intuition speaking very loudly to you. Avoid risky spaces and folks not willing to wear a mask to protect you. And gear up properly if you must venture out for food or other necessities. For all others, I'll reiterate what the mayor and so many others have been saying for many months. If you have symptoms, please don't go to work, don't go to school, don't go to church, and get tested. This is an opportunity when you have symptoms to go to a number of test sites that are community-wide to help you understand where now your risk lies for your friends and family, for your loved ones. I think now more than ever is the time to stop the spread. Now more than ever, it's time to get with the guidelines. The battle cry is simple, but it's not easy at times. Mask up, right? Mask up, wash up, and soldier on. And let's get through this. That's all I have to say, Mayor. We have to get through this together. Thank you.
Mayor, you're on mute.
Great points, Dr. Fry. I think, also having that messaging is that we can all do this together. And we were speaking a little bit last night and talking about, which I wanted to reiterate, that I know that all of you would agree with, is that many people will come into an emergency room and not know they have an underlying health condition. And one of those underlying health conditions is high blood pressure. Many people probably have not checked their blood pressure in a very long time, especially if they haven't gone to the doctor. And so that's another reason why you could be at high risk and not even know it. So it's not worth it to certainly take the chance. So great information. And we always appreciate everything that you bring to the table, Dr. Fry. So thank you. And then we will talk a little bit about testing at the end of this, but we have someone here with us today, and he is a very well-known pediatrician. It's Dr. Ron Ariel. We wanted to have him on today because this is really important. I've had a lot of questions into my office about trick-or-treating, the holiday season. How do families do this safely? What do you recommend? What are some of the things that we can do? Because I know that some neighborhoods probably aren't even going to trick or treat, but I've heard of some very innovative ways that we can do this. So from your perspective on the pediatrician side, Dr. Ariel, I'm going to hand it to you to give us some information about COVID-19 and also trick or treating safely. Thank you.
Well, thank you, Mayor Sheevy. And I want to thank also the members of the COVID data subcommittee with whom I've worked very closely, and this has become almost a full-time job. Really, there's so much to do, and it's been so challenging, but it's been a wonderful experience too. Let me begin by saying, today there was a Reno Gazette-Journal's frontline story today. Virus cases more than double in young kids. There's a big spike in kids 9 and under, and another spike in young people 10 to 19 years old. This is very concerning because 2 reasons. One, those kids are going to take the illness home to their parents and their grandparents and to people who are very, very vulnerable, such as people who've had organ transplants and people who are on immune suppressing drugs, people who have cancer, people who have lung diseases. And so that's very concerning. And the second reason is because young people can have permanent damage, even if they only have very mild symptoms or no symptoms at all. There have been studies in young athletes showing that permanent lung damage can occur from even mild infections of COVID. What that means is that during your 10s and 20s and 30s, you might be okay, you might function like there's nothing wrong. But when you reach 40, 50, 60, and your friends are hopping up the stairs to take the groceries in for the Super Bowl party, you're going to be huffing and puffing up those same stairs because you're short of breath, because your lungs are feeling the accumulated damage over the years. There's nothing, and by then it's too late. There's nothing you can do about it. So I'm really, really concerned about this. So number one, vaccinate. Everybody, all the kids should be vaccinated. Flu vaccine is licensed for all children 6 months and older. Get flu vaccine. The parents should get flu vaccine. Grandparents should get flu vaccine, and they have the senior shot, the shot with additional antigen, and now it comes in 4 strains instead of 3. Everybody get a flu shot. Get the childhood vaccinations, all the scheduled vaccinations on time. Get them all done. And adults too. There's a pneumonia vaccine, the Prevnar, afterwards the Pneumovax. There are vaccines for adults. Everybody get vaccinated because these are additives. These are, once you have, if you get the flu, you'll be more vulnerable to get COVID. If you have COVID, you'll be more vulnerable to get the flu. It's all additive and can all put you in the hospital with a machine breathing for you. So that's number one. Okay, now, and as far as the holidays go, and my comments, right now I go to Halloween, but really they apply to Thanksgiving or Christmas or anytime there's a big celebration and you want to get together with people. I would prefer that people not go trick-or-treating this year. I would prefer that they not have get-togethers for Halloween that don't involve people more than the actual people living with you. I would prefer that people use the free Zoom. There's a Zoom, I understand, is free. You don't even have to pay for it. You can use it for 45 or 50 minutes without paying. Take advantage of some of the free tools that are available on the internet. Stay at home with your immediate family. That doesn't mean your cousins and your sister and other people who live close to you but not in your household. It means people in your household. Stick within your household and invite other people in through Zoom, through video, not in person. Now, if you insist and you can't do that, or you feel that you can't do that, then meet outside. Use the park, use your backyard, stay 6 feet away from everybody, wear your masks, have a celebration that way, and do that, and strictly limit who comes over. Anybody with an underlying condition, if you're obese, if you have diabetes, if you have lung disease, if you have a autoimmune disease, if your rheumatoid arthritis is acting up and you need to take more of your medicine for that, don't go out. Stay away. Okay, protect yourself and protect other people. If you insist on going trick-or-treating, and I advise against it, but if you insist, then there are some mitigation measures. First of all, you wear your masks. Second of all, understand when you cross somebody's property line, you are a guest on that person's property, and you will respect that. You must respect that. So you see a house, you walk up to a house, one person at a time walks up to the door, knocks on the door, rings the doorbell. If there's no answer, or if the lights are out, or if they're indicating that they really don't want trick-or-treaters, don't persist, back off, go on your way, okay? When you walk up to the front door of a house, you knock on the door, step back away from the door, leave plenty of space on the door, let the homeowner open the door, admire the costume, that's very nice. Then the homeowner will put a reward perhaps on the front step, close the door behind him or her. Then you walk up to the door, pick up your reward, and move on. You stay away from the homeowner, stay away from the homeowner's family, and protect them from the possibility of picking up a disease. If we're talking about an apartment building with stairs and landings, stay away from it if there are a lot of people on the landing. If the landing's free and clear, then one person at a time goes up to the front door, knocks on the front door, backs away down the stairs a little bit, let the homeowner open the door, admire the costume from a distance, put the reward on the mat in front of the door, close the door, then you come up the landing, collect the reward, and leave. If there are elevators involved, usually the rules about elevators are no more than 1 or 2 people at a time in an elevator. Anytime you see more than that, stay away. If any building you want to enter looks a bit crowded to you, stay away. Your life and your safety and your health and that of your children are not worth a bag of candy. Okay, this year is this year, and if we have to forego certain things that we expect, certain rituals that we expect this year, and we have to postpone them to next year or even a little longer, we'll be alive next year and we'll be healthy to do them. And that's the goal. Okay, if you get sick this year and you have permanent consequences from that, you're not going to be happy. And and I wish everybody a very happy Halloween by video and a very happy Thanksgiving. And the rules are the same for Thanksgiving. No big gatherings, strictly limit who comes over. Have four, if you have yourself, your two kids, have dinner and put it on a video so that your other family has dinner, and then you share by video recipes and what you're doing.
Yeah.
And be happy with that.
All right. Thank you, Dr. Ariel. I really appreciate those safety concerns. It's very helpful. I also want to remind everyone, and I'm sure Rebecca and John will share it at the end of this. And if you don't have it, I'm sure you can give a link, John, to a great video that the city just put out about safe trick-or-treating. And so we will have that for you. I've also heard of some really innovative ways that some people are putting tables at the end of their streets and laying out candy there in cobwebs and sort of designing it, but kind of staying away and monitoring, candy gatherings there with very distant tables at the end of their streets. So a lot of neighborhoods are kind of doing this. We're also seeing people that are putting signs in their windows that are saying, sorry, no trick or treating this year. So I think that's a very effective way of communicating. And another thing is, a lot of parents have also come to the city and asked me, should my child, is it okay if they just wear a regular Halloween costume mask? Is that good enough to keep them protected? And actually, a doctor did tell me the best way to do that is actually have them wear a regular mask and then have them wear their costume mask over that could be effective as well if you're concerned and you're not sure if that Halloween mask does have protection. So if you are trick-or-treating, I would make sure that you also have a regular mask over your child's face. So with that being said, the other questions that I get a lot about is about going to the dentist and safety at the dentist. And all of us need to continue to make sure that we keep up our health in tip-top shape during this time, because we all tend to want to skip those things right now out of fear. And one of the things that we're finding is a lot of people are putting off their dental health, and that can be pretty dangerous, and it could even end you up in the ER and emergency situations. So I really wanted to have a wonderful family dentist with us today, and that's Dr. David White, who's well known throughout the community, and he's got great tips on that and is very, very knowledgeable. And I'd love for you to talk a little bit about dental health, and not to mention it seems very appropriate right now because we are into Halloween and lots of kids will be consuming candy. So I'm going to hand the floor over to you, Dr. White.
Well, thank you so much. First of all, I love the idea of let's cancel Halloween and save the teeth, right? Is that the message we're sending? So all kidding aside, I'm going to take a couple moments here to just go ahead and tell everybody that it has been an honor and a privilege to be able to participate on this COVID group. And I want everyone to know that there's the most amazing stakeholders here for you. These things aren't coming from one specific entity, industry, or anything alike. There are statewide leaders. There's the Washoe County School District. There are the local leaders, state leaders, medical physicians, people like myself, who's a dentist, who's also a small business owner. And it's one thing: they care. These recommendations come because they care. And we would like folks to truly understand that, because we're in a day and age of thinking regulation, 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 but it's not regulation. This is recommendation based on true care. So let's talk a little bit about dentistry. And really, we saw when our industry was hit hard and shut down, we learned a lot about this pandemic, and there was a lot of fear about going to the dentist as well. We lived in the infection control world for many, many years. This was something we were very comfortable with. PPE, we were very comfortable with infection control. We had to pivot to do in addition to. So yes, we wore masks. Yes, we wore gloves. Now we're doing things like face shields, and we don't really have many of our waiting rooms open, because this is the pivot that we've made to make sure that our staff stays safe, as well as the customer coming to the office stays safe. And let's start right there. Whether you're a dentist, whether you're a dental office, or whether you're a small business, reiterating what was mentioned before, you must take personal responsibility in this crisis, because that's what's going to be. And when you take personal responsibility, you're also becoming part of the team, or more importantly, the community. And this is the way then, if you have symptoms, You don't go to the dentist, you cancel. You don't go ahead and get that pizza because that's not an appropriate thing to do. You don't take your kids over to Bounce House or over to Urban Air or other things. And I don't mean to single that entity out, meaning that you just don't choose to do that for the betterment of personal responsibility and sense of community, because you will most likely get through that, and you will have to do your time of going ahead and taking that personal responsibility to get through your 10 to 14 days. And then life can then hopefully resume as normal. But only by taking that personal responsibility will we get through this particular crisis and come back again as community. And so talking about dental, yes, this was very important. We had a lot of people during the shutdown that didn't receive dental care. And this was quite the problem, because then they were developing abscesses and infection. And we were starting to go ahead and clog up the opportunity in the ER that could be used for more vital things during this particular crisis. So when we reopened and pivoted appropriately with the extra infection control, the extra PPE, and most importantly, the systems within our office to make sure that our staff is safe and our doctors are safe and ready to see you. We continue to go ahead and do our part to see the patients to ensure they were not going ahead and utilizing the important time in the ER and other utilized services, whether it's urgent cares alike, because there's many folks that utilize those services as their primary dental home. And this is a big problem. As we shift away from this, we must learn that now we need to go ahead and try to allow those services to, especially during these upticks, to allow their service to be utilized fully for the most important things at hand. And unfortunately, dental abscesses is not what we want those services to be consumed by. We want that to come to the dental office as we move forward. And so again, I'll speak to the individual business owners out there. Continue to do the excellent leadership that you have done. Continue to communicate with your staff. Open arms. Are you symptomatic? I have your back. Don't come to work. We'll get through this. Again, reach out to your patients or your staff members or your clients. If you're not feeling sick, don't come to our place, not because we don't want to see you, but because we all have to do our part during this particular pandemic. And I think that through that, we'll go ahead and become the community that we once were, and maybe even better, because we will have learned so much through this. And so at this point, I urge the community, if you're in pain or if you've delayed your dental services, and I'll add one more piece. Many of us paid for our dental insurance during that particular shutdown. You missed out on those services. That's going to go ahead and go away at the end of the year. So if there's things that you need to get done, we urge you, take advantage of that before the end of the year, so you don't end up in the ER during Thanksgiving, during Christmas, when this may be, we may be in the red. And again, those services need to be saved or more covetedly prepared for people that really need those services. And so again, I'd like to thank everybody on here for their caring, for thinking about the community and urging these great sentiments and recommendations going forward. But I know we can do it. I've seen the resiliency, not only within this community, but in the state and also in the country. We can do this, but there's going to be tougher times, and we're entering one of those particular tough times right now. So again, personal responsibility and sense of community will get us through this.
Thank you, Dr. White. I think dental health is so important, because I found myself putting it off and got into trouble. And that's why I think it's so important that you are here and messaging that, because people need to understand that it's very, very safe. And your industry is taking the best precautions possible. My dentist didn't even let me go into the waiting room. They actually temperature checked. I mean, it was pretty phenomenal. I was so proud of the leadership that your industry has taken. So thank you. And I think you make an excellent point about some people with their insurance and that sort of running out, but also at the end of the day, you can find yourself in an ER with, a type of abscess or something from not taking care of your dental health. So thank you so much. I think those are really, really important points. Again, I want to touch on the COVID risk meter.org is really important. And the reason why we developed that for everyone is that it's a tool so that you can put the power back into your own hands much like the pollen count, much like the burn code. It's a tool for you to use to know that those precautions are absolutely necessary. And we can stay open, we can stay safe if everyone wants to take that responsibility, like Dr. White said, that personal responsibility of doing your part. So I'm begging you as the mayor of this city, please do your part. I do not want to be here in 2 weeks and panicked. That's why right now, this is the critical time. We can do it together as a community. Again, there might not be a national policy, but at the local level, we can take responsibility and do it together. And that's why the COVID risk meter puts back that power into your hands of making those decisions. And again, we all know what to do. So let's all do it and remind your friends too. I know, some of the teenagers that I'm around, succumb to peer pressure and things like that. But remind each other that, wear your mask, social distance, wash your hands. I know we keep saying it over and over again, but I can't stress that enough. I want to touch on testing just a little bit. We are seeing some really quick turnaround times at Renown. They have been 24 to 48 hours and they still have drive-through services. Before you go get tested, I would tell you, call the location that you want to go to, whether that's a Walgreens, a CVS, the health department, because all of them have sort of different requirements. I know with St. Mary's, they are only testing you if you have symptoms. Renown is testing even if you don't have symptoms. And sometimes the reason why they do this is you might have an employer that requires you to have a negative test to come back to work, right? Or you might be traveling and they might require you to have this for travel. So Renown is doing that even if you aren't experiencing symptoms, and so is CVS and Walgreens. And I'm hearing great things about Walgreens right now, that they are coming back with tests almost in the same day as what I'm hearing, and it's been pretty quick. So, but as we get into this holiday season and flu season, I imagine those locations are going to become much busier. So everyone needs to remember that when they're thinking about going to get tested. And so, now is a really good time to, start thinking about that and starting to prepare and plan. And one of the things, if you want to be around family and friends over the holidays, prepare, plan that maybe you quarantine for 14 days before you see family members, if that's exactly what you have to do. But also remember, a lot of our family and friends during the holiday season are older seniors, and many of them are at high risk. So please think about them. You might not be, but it's really up to you to also protect them. And as a community, we can do that together. I would also say the health department will have a presser tomorrow. They've been having regular pressers, so they can speak a little bit about what they're doing with testing. I do know it is taking a little bit longer through some of their channels. I'm hearing, 5 to 7 days. So I want people to realize that there can be a delay there, and that can be challenging because you can wait a while for your results. So call around and find out what works best for you. So I can't stress that more. But again, I want to say thank you to everyone on this panel today. This messaging is so critical. And again, as your mayor, I am concerned. I'm extremely concerned. I don't want to be back here in 2 weeks with Dr. Fry, and we're finding ourselves in some really challenging positions, and not to mention with our ICUs filling up and things like that happening. So if we all do our part now, we can truly save our community from some really disastrous situations. So with that being said, I think I'm going to hand it over to John Humpert as we wrap this up, if there are any questions that you have anyone on the line. So go ahead, John.
Yeah, you bet. We'll just, we'll start with Brian Hoffman.
Hey, thank you guys so much. I appreciate it. Can you hear me?
Hi, Brian, go right ahead.
Hey, Mayor. I was wondering, since we're kind of thinking that we're going to be going into the red, are we going to be using this meter to judge if there's going to be any type of further restrictions or anything implemented by the city, or are we handing that off to the governor's office to install any type of restrictions or limitations?
I think that's a great question. First of all, we still are under the governor's directive. I want to remind everyone that any standards that he puts in, those will be uniform state guidelines, correct? So I want to stress that the COVID risk meter was really an educational tool, and to be able to communicate to the community where we are at. right? We think that's really important because so many people would say to me, well, how do I know if we're at risk, or how are we doing in the community? This is a way for us to gauge that. We don't recommend that that's where, there's a hard line of like, oh, at this point there's a shutdown. It doesn't work like that. This is really to empower you to make your own decisions. It's different for everyone. Remember, I take immunosuppressants. I've had a kidney transplant. And so I do have comorbidities. Others, that are maybe younger and very, very healthy, don't have to, be as diligent as I have to be, or concerned as I have to be, right? So it can be subjective for each individual of what their risks are. Maybe you work in an environment where there are a lot of people and they're not masking. It's up to you to say, hey, we're in the red, or we're going in the red, please put on your mask. I will say I'm impressed with, the places that I've been, especially I think Dr. White touched on this with our business community. They have done a fantastic job with masking up. I really appreciate that. We cannot let up now. If you do not, if you see someone not wearing a mask, ask them kindly. I think it's really, really important right now. And remember, wearing a mask is uncomfortable. None of us like it, right? But it's a very, very small thing to do to keep someone healthy, safe, and certainly alive. So we've got to stress that now more than ever. But I do want to say the risk meter is really for communication and for you to make those decisions and understand the progress that we are making in the community, or if we are regressing in the community. And that's why this tool is so critical, and all of us can play a part in how this tool is used and whether it goes up or down. And Jeremy, you might want to piggyback off of that, since the risk meter is your baby.
Oh, thank you. Yeah, well, it's been a team effort by far, and I appreciate everyone's input. And to what Dr. White was talking about and others, I mean, it's a great team, and the people really do care. And so this tool is designed to give the community information, and we're constantly working on making that information delivery better. And so there are some improvements in the works. We're putting a frequently asked questions page up. Hopefully later this week, we're going to detail the methodology we use. We have this stuff ready to go. So stay tuned, I think, to the Meter website to see it improve over time. But yeah, I just think that now is our chance to see how it's been. These data don't lie. They're the data that are out there, and they're coming together, and they're moving us towards that red condition. And so it's up to us as a community right now to do our best to try to stay out of that condition by social distancing, wearing our masks, and doing all the good things that were mentioned on this call.
Yeah, and I think it's important this data is legitimate, and it also provides us as elected officials to be very transparent with that data. I think in the beginning, people were very frustrated with some of the messaging they heard or some of the data that they might not have been getting. This is a very, very good indicator. So we're fortunate to have it and stressed to use it.
Prior to this time right now, Washoe County had been doing very well in terms of transmission rates. And we were really looking at Southern Nevada as sort of a hotbed. But more recently, Washoe County's gone ahead and is taking the lead for the state. And so the COVID risk meter is good whether we're low or high. And we want to basically say what's happening locally, not necessarily statewide. And that's one of the reasons that we developed the meter. It's based on local data versus statewide data, although some of the data does come from the state. I want to be clear on that, but it's about Washoe County specifically. And to your point, Mayor, about travel and some of the other doctors, I traditionally always went for Thanksgiving to join my family, all flying in. This year I called them to get ready to make my plane reservation. First time I was going to go on a plane. And they said, each family said, Naomi, we're socially distancing this year. We're not flying in to get together for Thanksgiving. And I was so proud because as much as I'm in touch with this data, I hadn't really integrated that into my personal behavior. And I have now. So I made no plane reservations, and I realized we need to do that on Zoom. So,
all right, John,
example.
Back to you.
Fantastic. We'll go with Jenny Kane now.
All right. Hi, Jenny.
Hey guys. Thanks for having me. I'm not, this isn't my usual wheelhouse, so I apologize for my first question, but
That's okay.
you guys keep talking about going into the red. I'm not super familiar with the meter. Is there a tipping point where you go into the red? Like, what does that specifically look like?
All right, Jeremy, I'm going to hand it to you.
Yeah, absolutely. So the way this model works is it uses five data indicators or variables and gauges where they're at. So how many people are coming to get testing? What's our test positivity rate? How are the cases? And then the two hospital stats I mentioned. And so as those all kind of go up, the score accumulates. And so what takes you into the red is a score of 9.5. And today we had a score of 9. Or actually yesterday, I'm sorry. So I'm waiting on the data to run today's measure. So basically, it's an additive measure. And the more that all of these conditions that describe the state of affairs, the state of the community in terms of COVID, as they go up, it adds together. And the more it adds together, the higher the number. And that takes you into the red and, ultimately would be the purple.
Gotcha.
But we never get there.
And I have a few questions. Is it okay if I go down the few? Or do you guys want to?
Of course. No, you're fine.
Okay. So the other one, and you're going to hear my daughter asking for me through the door, so apologies.
You're my dog, so it's good.
So Kevin Dick had also said that local governments are allowed to establish more restrictive measures than 250. Is the city considering any kind of more stringent controls on gatherings at this point?
Sure. Well, one of the things we really want to stress is being uniform with Sparks and the county. So we do have the ability to do that. And as we get further into the winter months, that's why the COVID risk meter is so important. We're going to pay attention to that data. And if that's something that we need to do, we certainly will do it. And again, that's why this meter is so important, because if we all modify behavior right now, then we don't have to take those stricter precautions down the road. But I also think it's critical that we're on the same page with the other jurisdictions when we come out with those initiatives. Again, we might not have a national policy, but we can certainly have a local policy that can be effective. But we all have to make sure everyone is, on the same playing field. So that's going to be critical too. But as this information comes in, we absolutely will watch it. And if we have to make more restrictions, we certainly will. But this is the time to really message that we don't want to go to that extreme, right? And we don't have to if we all do our part. And I think that's what's so important about this. All of us doing our part with, mask wearing, social distancing, washing our hands. I know we all, like I said, I know I sound like a broken record, but if we have to take further precautions, I absolutely will.
Is there a point though that you reach, like if you go into the red, or what's the very red, the very severe, is
maybe I
that
could help
the
on
point
that
where
one.
you start going into the stricter measures, or what is the trigger
Right.
there?
Mark? Sure.
Yeah.
Well, first of all, I think those benchmarks are different, right? Depending on the data that Jeremy collects and also what our physicians are seeing, what our health department is seeing. It's sort of a mix of metrics that we have to look at. So it's not any one specific metric. So I want to make that clear. So it just depends on really what the medical community and the health department are seeing. And that's what's going to be critical, instead of just, someone saying, oh, I saw one person not wearing their mask, or we got to do this. It's got to be very, very measured, because we want it strategic and we want it effective. Councilwoman Dewar?
Yeah, just to add on to that, I know our staff are looking at it very closely. To your point, Mayor, the school district, they're going to take in a variety of measures. They're going to start with the COVID risk meter. That's what they've told me. But then based on what their population is, if it's a school district and it's children, they're going to add in what's the transmission within children. If it's something happening in small businesses, I know our staff are on it. I talked to them even as recently as this morning, and they are looking at, what does it mean if we go into the red? They're trying to get ready, just as we all are. And what we're all trying to do, of course, is prevent getting into the red.
Yeah. Speaking of youth, Mayor or whomever, what is the opinion on keeping schools open as these numbers rise?
Well, I am not the school district, so it's really not in our jurisdiction. I think our responsibility is to give them as much information as possible. We have had them at the table to educate them with the risk meter and what that data is and what it looks like. So, I think our job is to continue to message to them and for them to understand, what precautions need to be taken. I also am of the belief that, you don't close down all the schools. If you're seeing a specific spread in one location or one school, that's where you really have to take action, right? So I want them to pinpoint some of those initiatives when it comes to if they're seeing, in one location. I think you have to be very careful about sending that message across, the entire school district if it doesn't apply to another school or location.
Okay, one more question, then I'm done. For the doctors, I was curious. I've been reading. My sister is a nurse, and so I kind of follow what's happening, among the medical community. One of the concerns I've heard time and again is that staff are, to some extent, I guess for some of them, are more concerned about getting exposed in one way or another and missing work, what it means for them, not only personally, but also for the staffing levels. And I'm really curious to hear you guys talk about, how medical institutions are going to handle staffing, as obviously CDC has indicated that a higher percentage of medical professionals get exposed. So just curious how staffing is going to fare during
Okay,
winter.
great question, by the way. I'm going to send it over to Dr. Fry, since you are working with a large amount of staff, and then Dr. White, since you work with staff as well. So go ahead, Dr. Fry.
Thanks, Mayor Shivi, and I appreciate the question, Jenny. We've learned so much on how to keep ourselves safe so we can keep this community going. When I go into work, like my colleagues, nurses, techs, all the ancillary staff, as well as physicians, we just know a lot more about how to protect ourselves well. And the kind of gear that we are consistently using every day to do so has changed a little bit. I actually, it's a fortuitous question. I have a fancy Envo mask here, which is an N95 that's very comfortable because you have to wear this thing for, 9-10 hours. And it's kind of miserable if it's not comfortable. So it's a nice seal around here. And then to further protect the public, we even put another mask over the top of it. And so this gives us a tremendous amount of comfort over time. Not everybody has an Envo mask. That's about $100 or so online. The N95s are widely used by staff and are highly protective. We've actually had very little emergency staff go down. I can't speak to the entire system, but those that are on the front lines and arguably most exposed beyond the ICU or COVID units have been relatively, spared because of their proactive decisions on how they gear up. So just like any job, OSHA regulations aside, we all have specific things we need to do to protect ourselves in any industry, and ours is no different. We do what it takes because I want to keep being able to be at the bedside for my community.
Yeah.
Thank you.
And Dr. White, I know that you've put a lot of protocols in place, and actually a lot of other businesses, I think this is a really great topic, and we can cover this at another presser sometime. But protocols for businesses, if you do have a staffer that has tested positive, what does that look like? How long do they stay out of the office? Do you require for a test to come back? I mean, there's a lot of those sort of questions, right? But Dr. White, I know that you have done a phenomenal job in your practice. So why don't you speak a little bit about staff?
Yeah, so just I'll speak of dentistry, but I'll also speak obviously in small business, because a little bit different than larger hospitals, which have different systems. We still kind of have, most of us are little cottage industries. And so we have a little bit more control. So I'll use my own example. So almost every Sunday night, I throw out a text message to my staff, how are we feeling? That's the most important communication to get out. How are you feeling? Are you not feeling well enough to come to work on Monday? So the buck stops there. And then that proliferates onto, okay, if you didn't feel well now, when was the last time that you had potentially patient interaction? And then if you do test positive, that gives us the parameters and the guidelines on contacting the patients on whom you might have had interactions with. So it becomes just a systematic approach. And when you've been through this enough times, then your staff immediately knows what to do. It becomes almost second nature in that. I've always believed, and I wanted my business owners, because I work with the Nevada Dental Association, I wanted my dentists to not have fear and shame, because in my mind, it wasn't really an if, it was a when. And are you prepared for that to come into your world? When you're not prepared and you haven't communicated with your staff, then you are at the mercy of fear. And that's the way COVID gets all of us, is fear. And so again, if you have a plan in place where folks, yes, you may have been symptomatic or you may have it, but you know immediately what you need to do from the support of the entire team. And so that's what we've done, is we've just instituted phenomenal communication from top down and support from all the other team members. Have we had team members throughout the entire country or even our state that do not feel comfortable? Absolutely, folks. This, everybody is entitled to individual opinion. Has it affected our workforce? It certainly has. And so maybe dental assistants are a little bit more difficult to come by, but I personally told my doctors, we respect people's opinion. And if they're choosing to stay out, then you know what? That's just I don't want to say the cost of doing business, but ultimately it is. And we respect individual freedoms for that. And so you educate your staff. You're gonna have people that are gonna feel comfortable, and there's gonna have people that don't feel comfortable. And should that time be where they need to maybe move on or stay at home for a bit, then that's what's going to be best for the community, for the team, and certainly that individual and their family. And so, this is something that I've dealt with very personally. I will admit I did have a COVID positive within my particular office as well. And again, because I was so intimately involved from the national shutdown and the reopening, my staff were seasoned veterans. They knew immediately what to do. We immediately contacted patient. And of course, we were fearful of what that was going to entail. But you know what? We were open, we're honest, and people appreciate that. Not only did we tell them, we then told them what they needed to do. So again, it wasn't about, you may have been exposed to COVID. Okay, well, we'll talk to you later. No, it was, this is what you need to do. And you lay out the protocols for them as well. And so it really just comes down to a systematic communication from top down all the way through. And that's where I urge the business owners out there, if you haven't instituted this right away, please begin to build that communication system. Please build that system. So if and when it does happen, I don't want to scare anybody, but the when is probably, inherently going to happen at some point. You're going to be prepared and you won't be at the mercy of fear. And more importantly, the people that are looking to you, they'll continue to go ahead and confide in you and believe in you because you laid out the plan for them to stay safe and get through this.
All right, John, back to you.
All right, we'll go to Stanton now.
Hi, Stanton.
Oh, having a little bit of trouble here. The mute button isn't quite working. All right, well, we'll cycle back. We've got Brian on the call. You look like, because I know you had a question. There you go. Go ahead, Brian.
Hey, yeah, I'm back. So kind of piggybacking off of my previous question, I know that you didn't really want to go into restrictions too much, but should we get too far? Should we get into, I believe it's the purple, past the red? Are there any plans that the city of Reno has to either maybe put in, maybe not restrictions, but anything to help out local businesses or families? I know that rent is a little bit more on the governor's side and on the state and federal government. But are there any plans that the city of Reno has should we get further into that red or the purple?
Well, again, I think it's watching this information and data closely, right? Because that's really going to dictate the next steps that we are going to have to take. And certainly we don't have any issues with taking further precautionary measures throughout the city. Anyone that knows me knows I take this extremely seriously. So I'm asking you to do your part now so we don't have to. So businesses can stay open and kids can stay going to school. I think that that's, really important. This has been a very stressful time, not only for your physical health, but your mental health. A lot of people have struggled with, their mental health and stress and anxiety. People that we've never seen have, mental health issues, right? So I'm following it extremely closely, and I would like to stay on the same path as the other jurisdictions. And I think as we watch this information come in, we don't want to be messaging, like I keep saying, in 2 weeks that we are going to have to do something drastic. That's why we are doing it today. If I could stress one thing to our community, let's do this today, because I think we are in for a pretty long 3 to 6 months. I mean, this is not something that, can be done in a day or two. We can all do this together. We can all play our part. We can all make a difference. Let's not be the one on the map on national television. That is not going to be helpful. And not to mention, if that's the case, we know that we will lose lives. And so all of us doing this together. But again, I won't think twice about coming in with more restrictive measures or, even a mask mandate if that had to be the case. But I got to say, I'm very proud of our community. They've done a phenomenal job with the masks on both sides. This isn't, for me, certainly a political issue in any way. It's, about life safety. And all my friends, whether they're Democrats or Republicans or an independent like myself, they think the same way. They're all, being extremely careful and vigilant and wearing their masks and things like that. So I think I'm really proud of our community on that front. But again, as we watch this information come in, is if we are seeing that our ICU beds are becoming extremely, if they are becoming extremely, less and less that we can facilitate the community from getting healthcare, that's going to be a big problem. And we're going to have to message differently. And again, that's why we're here today, because we are seeing us trend up. And we know that this could get into a very dangerous situation. And again, as the mayor, it's my responsibility to make sure that I'm keeping this community as safe as I possibly can. And, I don't have any tolerance for people that say this is a hoax or it isn't real, because it is very much real. And if you lose a family member, you will be thinking something completely different. And, that just isn't okay, and it's not acceptable.
Thank you so much, Mayor. And I did have one quick follow-up with the COVID-19 response task force having that emergency meeting with Washoe County and other local officials. Are you guys going to be a part of that meeting as well? And can you
the city of Reno?
Yes, ma'am. They did mention that they wanted to have the city of Reno as part of that meeting on Thursday, I believe.
Oh, yes. So we have been invited to that meeting. It's all of the jurisdictions, which is fantastic. That means we can all stay on the same page and also have one unified voice for the entire community. I think that is really critical. I think that was actually some of the pieces that were missing early on. So yes, we are going to be there. And, now more than ever, I think we're all working together, which is really, really critical and really important. So we will be there.
Excellent. Thank you. That's all I had. I appreciate it.
Stanton, we're gonna try one more time for you here. We're having some muting issues. Okay, well, Stanton, we'll give you one more shot if you want to put anything in chat. Jenny, did you have anything here at the end?
I wonder if,
so.
okay. Sorry, Jenny. I wonder if Stanton can hear us. Can he type in the Q&A? Is that possible?
That's an option. By all means, if you have anything, Stanton. May just be recording it later. Oh, go ahead, Matt.
I also texted Stanton and hadn't heard back, so I just wonder if maybe he dropped off the call altogether.
So,
Okay.
Possibly.
All right.
Well, Jenny, anything else?
I think I'm good. Thank you, guys.
All right. Thanks, everyone. And thank you to the entire panel. You guys have been fantastic. I appreciate all that you're doing for our community. And thank you to all the media, it's so important that we work with you because you guys do a phenomenal job helping us educate the public and getting the word out there. So thanks everyone and be safe. Thank you. Goodbye.
Thanks, everyone.
Thank you.
Thanks
Bye.
all.